Symptoms of a peanut allergy are hives, particularly around the mouth. There can also be swelling of the lips and also around the eyes. There can be some symptoms of the nose, like sneezing, like runny nose, like a cough. And then you can also get itching in the ears or hives elsewhere in the body. In the throat, you can get a tickly throat or scratchy throat or sore throat. And if your throat starts feeling blocks or you start having a persistent cough or your throat feels swollen inside, then that's compromising your airway, and that's actually considered a life-threatening reaction called anaphylaxis, and that would warrant treatment with adrenaline. So reactions to peanut can also cause gut issues. So you could develop some abdominal cramping pains, some vomiting, or some loose stools. And also it can cause some breathing problems. So it could cause some wheezing, could cause a persistent cough, could cause some difficulty breathing. And in that situation, again, this would be classed as having anaphylaxis and would be treated with adrenaline. And then finally, having an allergic reaction to peanut can impair consciousness if the reaction is an anaphylactic reaction. And that would then lead to symptoms such as feeling persistently dizzy or pale and lethargic and weak, or feeling like you have to lie down, or potentially collapsing. And again, in that situation, the treatment of choice would be adrenaline. Peanut allergy typically develops in children under the age of 1. So if the child has severe early onset eczema, this can develop even earlier. So could develop even between the ages of 4 to 6 months. Some children only find out that they're allergic when they're teenagers because the family don't actually eat these foods at home. It's not a commonly habitual food for the family. And also the child instinctively knows that they don't like being around peanuts, they don't like eating peanuts, and so they avoid them. And then sometimes they may have their first reaction when it's masked, such as in a curry, when they're a teenager, and then have their first allergic reaction. But they will have been allergic to peanuts for some time before that. Well, a child is not born with peanut allergy. They develop peanut allergy over the first year of life, usually. And they can certainly develop a sudden peanut allergy because in the background, their immune system is working and they've had some exposure to peanut, potentially through the skin, through environmental exposure to peanut, if they have an inflamed, disrupted skin barrier like eczema. And then when they eat peanut for the first time, they can actually have their first allergic reaction. And as I said, especially in somebody who has been avoiding peanut for their whole life, not through knowing that they're allergic, but just because it's a personal choice, they may then suddenly have an allergic reaction when they're older. And this is because this is their first proper exposure to peanut. Ensuring your child is safe at school if they're allergic to peanuts is of paramount importance because around 20% of reactions to foods occur in school. If a child has a food allergy, they should have an emergency action plan or an allergy action plan, which the clinician who has diagnosed the allergy should provide to the family and potentially also the school if requested. So the allergy action plan comprises what the child is allergic to and what to do in a mild to moderate reaction and what to do if the child's having a life-threatening reaction or anaphylaxis. So in terms of managing mild to moderate reactions, the types of symptoms would include hives, swelling, vomiting, abdominal pain, or change in behavior. And that would be managed usually with a non-sedating antihistamine that acts quickly, like cetirizine, which is the generic name, but is also known as Pyretes or Benadryl for children in the UK. And then the allergy action plan also contains information on what to do in case of a life-threatening reaction, and it lists some of the symptoms that can compromise the airway, breathing, or consciousness, which I described before. And then it tells you what position to put the child into if they're having anaphylaxis. So that would be lying down with their legs raised if they're having problems with consciousness, or sitting up if they have problems with their airway or breathing. And then it would then say to use the adrenaline auto-injector and then to call 999 and say the words anaphylaxis. Thereafter, if the child is no better after 5 minutes, you would use the second adrenaline auto-injector into the other 5. Now, all of this is very important because it gives very clear instructions if there is an allergic reaction, and it also advises the school on what the child is allergic to. So the parents will need to put a photograph of the child on the allergy action plan, their emergency contact details, and also consent for the school to administer the emergency medication. Now, most schools are actually nut-free, but that doesn't preclude some children bringing in nuts when they're bringing in their snacks, although the school does try very hard to prevent that from happening by advising the families of this and also advising children not to share food. But sometimes there can be mistakes, and so it's important that the family liaise directly with the school, give them the allergy action plan, find out where the medication will be kept, and find out what the school's plan is in terms of providing lunch for the child and how they will ensure that that child is kept safe at school. The age at which a child can start to take allergy medicine is very young. So in terms of the types of antihistamines that are available, the non-sedating antihistamines are generally available from 2 years of age as a licensed product, but many doctors prescribe them under 2 years of age using the weight of the child and the known dosage required. And this is off license, but as long as it's discussed with the family, it is safe to use. Then chlorphenamine, which is often known as Piriton, is licensed from 1 year of age. And again, that is often prescribed by doctors under 1 year of age with the family's consent, with the knowledge that it is unlicensed under 1 year of age. These medicines are safe to use under their unlicensed age range in the event of an allergic reaction, because it's important to have some treatment available for those allergic reactions. And often unlicensed medicines in paediatrics are purely because the studies have not included children down to a younger age group. I would say that in terms of sedating antihistamines, I would not recommend taking this allergy medicine every day. There is good data to show that it interferes with the sleep quality, so the child will not be sleeping as well as they could. And also it can interfere with their concentration during school and with their daily activities. So I would not recommend giving chlorphenamine or Piriton on a daily basis. In terms of non-sedating antihistamines, as long as they are being used at the correct dose or at the dosage which is required for that particular condition, then they are safe to use long-term, as long as they are regularly reviewed to ensure that the individual still needs to use the medication.